Imagine for a moment walking through the grand, heavy wooden doors of a 19th century hospital. It is supposed to be a sanctuary, a place of healing where the brightest minds of the era gather to conquer disease. But as you walk down the stone corridors, you do not hear the quiet murmurs of recovery. Instead, you hear the desperate, echoing pleas of young pregnant women. They are weeping. They are falling to their knees. They are begging the nurses to let them go back out into the freezing streets. They would rather give birth in a filthy alleyway than be taken into the doctor's ward. They knew a dark truth that the medical elite refused to acknowledge. They knew that women who walked into that specific ward rarely walked out. A shadow hung over the brightest medical capital of the world, quietly taking the lives of thousands of healthy young mothers in the prime of their lives. It was an invisible massacre, hidden behind the pristine white coats of the most respected men in society. And the most terrifying part of this historical nightmare was not the disease itself. It was the fact that the doctors, the very men celebrated for their unparalleled knowledge and dedication, were carrying an invisible death. They had no idea they were the ones committing the murders. The year was 1847. The location was Vienna, Austria, home to the Allgemeines Krankenhaus, the Vienna General Hospital. At the time, it was the largest and most advanced medical facility on the face of the earth. People traveled from all over the globe to study in its halls. Medicine was transitioning from medieval superstition into a modern science. Yet amidst this golden age of discovery, a horrifying epidemic was sweeping through the maternity wards. It was called puerperal fever, commonly known as childbed fever. Healthy women would deliver their babies without complication, only to fall violently ill hours later. Their temperatures would skyrocket. Their abdomens would swell with agonizing pain. Within days, sometimes hours, they would suffer a slow, agonizing death. The core mystery of the Vienna General Hospital was not just that this disease existed, but how it operated. A young Hungarian doctor named Ignaz Semmelweis had just been appointed as an assistant in the maternity clinic, and what he found in the hospital ledgers would haunt him for the rest of his life. How could the most advanced medical ward in Europe become a slaughterhouse? What was the official story being told to the public, and why did the numbers simply refuse to add up? There is something deeply unsettling about a place of healing that suddenly turns lethal, and the truth hidden in those hospital records was far more chilling than any natural outbreak. To understand the sheer magnitude of this cover-up, we must first look at the official narrative. We must understand what the greatest minds of the 19th century believed was happening. When thousands of women began dying in their beds, the medical establishment did not ignore it. They studied it. They wrote endless, complex papers on the subject. They framed it as a tragic but unavoidable act of nature. The mainstream explanation of the era was something called miasma. Leading scientists believed that invisible clouds of toxic air, rising from swamps, decaying matter, or even coming from the cosmos, were drifting over the city. This atmospheric corruption was said to be breathed in by the patients, causing their blood to turn toxic. This was the accepted truth. It was taught in universities and printed in textbooks. When miasma was not enough to explain the deaths, the official narrative shifted to other, equally confident explanations. The hospital wards were too crowded. The women were suffering from poor diets. Some doctors even suggested that the tight petticoats the women wore during their pregnancies caused severe internal damage. There was even a psychological explanation. A hospital priest regularly walked through the wards ringing a small bell to signal the administration of the last rites to dying patients. The medical establishment officially claimed that the sound of this bell terrified the fragile nerves of the new mothers so severely that the sheer panic induced a fatal fever. This was the science of the day, presented with absolute certainty, delivered with a neutral, authoritative tone. It was a tragedy, the authorities agreed, but the doctors were doing everything humanly possible against an unstoppable atmospheric force. But Ignaz Semmelweis was not satisfied with the official narrative. When he began to dig into the archival records of the hospital, he noticed the first cracks in the accepted truth. And these cracks were not subtle. They were massive, glaring discrepancies that the medical elite had chosen to blindly ignore. The Vienna General Hospital had two separate maternity clinics. The first clinic was designated for the training of doctors and medical students. The second clinic, located just down the hall, was designated for the training of midwives. If the deaths were truly caused by a toxic cloud of bad air hanging over the city of Vienna, both clinics should have suffered equally. They did not. Semmelweis looked at the numbers, and the numbers painted a terrifying picture. The first clinic, run by the educated gentlemen of science, had a mortality rate that routinely hovered around 10%, and during some months spiked to an unbelievable 18%. Nearly 1 in 5 women entering the doctor's clinic was leaving in a coffin. The second clinic, run entirely by midwives, had a mortality rate of less than 2%. This single piece of evidence completely shattered the official story. How could a cloud of toxic air selectively hover only over the first clinic? How could overcrowding be the cause, when the terrifying reputation of the first clinic meant that the second clinic was actually far more crowded? Women were literally begging on their knees to be placed with the midwives. And perhaps the most damning piece of evidence of all, Semmelweis discovered that women who gave birth in the filthy, freezing streets of Vienna before reaching the hospital had a drastically higher chance of survival than those who gave birth in the pristine beds of the doctor's ward. The official story was collapsing under the weight of basic mathematics. The deaths were not random. They were localized. The shift from neutral observation to active investigation had begun. The sheer curiosity of this gap in logic was maddening. If it was not the air, and it was not the ringing of a priest's bell, then what was killing these women? Semmelweis began to methodically explore every single variable, dissecting the daily routines of the hospital piece by piece. He structured his investigation with cold, scientific logic. He decided to test the establishment's theories one by one. He rerouted the priest, forbidding him from ringing the bell, forcing him to walk silently through a different corridor. The women in the first clinic continued to die. He changed the birthing positions of the women in the first clinic, making them lie on their sides to exactly mimic the practices of the midwives. The women continued to die. He adjusted the ventilation. He monitored the diets. Nothing worked. The invisible killer remained. He had to look closer at the figures involved. He had to look at the doctors themselves. Who were these men? They were pioneers. They were men of the Enlightenment. In 1847, the frontier of medicine was pathological anatomy. The way to understand disease was to study the dead. Every morning, the doctors and the medical students would gather in the hospital morgue. They would spend hours dissecting the rotting corpses of the patients who had died the day before, searching for the physical mechanisms of illness. Their hands would be covered in blood and tissue. And then, when a woman went into labor in the first clinic, these same dedicated men of science would wipe their hands on a rag, walk down the corridor, and perform intimate vaginal examinations on the mothers. The midwives in the second clinic, on the other hand, did not perform autopsies. They did not touch the dead. They only dealt with the living. Could it be? Keep in mind, this was decades before the concept of germs or bacteria was discovered. The idea that microscopic organisms could transmit disease was considered pure science fiction. But a hidden pattern was beginning to emerge in the dark corners of the hospital. Is it possible that the greatest medical advancement of the era, the deep study of anatomy, was the exact mechanism of a mass tragedy? What if the truth was that the gentlemen of science were entirely blind to the dirt on their own hands? A tragic event brought this alternate theory crashing into reality. Jakub Kolečka, a highly respected professor of anatomy and a close personal friend of Semmelweis, was conducting an autopsy on a woman who had died of childbed fever. During the examination, a clumsy student accidentally slipped and pricked Kolečka's finger with a bloodied scalpel. Within days, the strong, healthy professor fell violently ill. Semmelweis watched in horror as his friend developed a high fever, severe abdominal pain, and massive internal swelling. Kolečka died a painful, rapid death. When Semmelweis reviewed his friend's autopsy report, he experienced a moment of profound, chilling realization. The internal damage, the pathology, the infection inside the male professor's body was identical in every single way to the bodies of the mothers dying in the maternity ward. The pieces connected into a compelling, logical, and deeply sinister pattern. It was not bad air. It was not a ringing bell. It was something physical. Semmelweis called them cadaverous particles, invisible pieces of death that clung to the skin of the doctors. The medical students were going directly from tearing apart the rotting flesh of the dead straight into the wombs of the living, planting the seeds of death directly inside their patients. They were accidentally killing the very people they were trying to save. With this damning evidence in hand, Semmelweis reached the climax of his investigation. He knew exactly how to stop the slaughter. He instituted a strict, uncompromising rule in the first clinic. Before touching any living patient, every doctor and student was required to scrub their hands in a basin of chlorinated lime solution until the smell of decaying flesh was entirely gone. The results were immediate and absolute. In April of 1847, the mortality rate in the first clinic was 18%. By the middle of the summer, after the hand-washing rule was enforced, it plummeted to less than 2%. The following year, there were months where the mortality rate was 0. Not a single woman died. The mystery was solved. The evidence was irrefutable. It was written in black and white in the hospital logs. You would expect this to be a moment of global celebration. You would expect Semmelweis to be hailed as a savior, decorated with honors, and his methods immediately adopted across the world. But that is not what happened, and this is where the story of the 1847 maternity ward becomes a dark reflection on human nature. The truth was violently suppressed. When Semmelweis presented his findings to the medical establishment, he was met with outrage. The elite doctors of Europe were deeply offended. In the 19th century, a gentleman's hands were considered inherently clean. The social hierarchy dictated that a man of science, a man of high social standing, could not possibly be the vector of filth and disease. To suggest that the leading medical minds were inadvertently acting as the Grim Reaper was an insult to their pride. Letters and testimonies from the era, many of which were overlooked for decades, reveal a horrifying arrogance. Prominent doctors mocked Semmelweis. They refused to accept the statistics. They argued that the water in Vienna was too cold for doctors to be expected to wash their hands frequently. They clung to their theories of bad air and tight corsets because it absolved them of any guilt. The establishment systematically dismantled Semmelweis's work. They let his contract expire and pushed him out of the hospital. Without his strict oversight, the doctors abandoned the foul-smelling chlorine basins, and, predictably, tragically, the mortality rates in the first clinic immediately skyrocketed back up. thousands more women would die painful, unnecessary deaths simply because the medical elite refused to wash their hands. Ignaz Semmelweis spent the rest of his life trying to convince a world that refused to listen. He wrote open letters calling the leading doctors of Europe murderers. His obsession drove him to the brink of insanity. In 1865, he was lured into a psychiatric asylum by his former colleagues, beaten by the guards, and placed in a straitjacket. He died 2 weeks later, ironically, from a blood infection in his hand, an infection terrifyingly similar to the one he had spent his life fighting. We look back on this forgotten story buried in the archives, and we call it ignorance. We comfort ourselves by saying that science simply had not discovered germs yet, that they could not have known any better. We frame it as a tragic delay in the inevitable march of human progress. But the numbers were there. The undeniable evidence was written in the hospital ledgers, plain as day, decades before microscopes proved it to the world. The lives were saved, and then they were deliberately thrown away to protect the egos of the powerful. Maybe it was nothing but the stubbornness of a bygone era. Maybe it was simply a series of tragic accidents in the pursuit of knowledge. Or maybe the people who lived through it saw something we no longer recognize. A reminder of how easily the truth can be buried, how quickly undeniable evidence can be suppressed when it threatens the pride of those in authority. What else sits undiscovered in our own time, staring us right in the face, simply because the experts refuse to look at their own hands?